we think that as a small employer, here's the questions that we should be thinking about and actually know how it'll impact our business. So, and historically, health insurance has been a lower cost way to compensate an employee than providing benefits. If I give somebody a $100 pay increase, it really costs me about $115. Increased FICA match, potentially depending on the state you're in, work comp increases, so on and so forth. Whereas I pay in benefits, that $100 towards benefits might only cost me $85 as a company. That's, at least for now, stays true of offering a group-sponsored health insurance plan. Is that there's some tax advantage to offering group benefits. Small employers can get a $3 to $7 return on investment for every $1 they spend on wellness. And to be perfectly honest, with some of the insurance carriers, you don't have to spend a single dollar to incentivize wellness of your people. You can do it for no cost, and there's strategies in doing that. But I want to challenge employers to think through this, not only because there's potentially a 30% swing in your contribution as an employer by having wellness in place, but also the impact on productivity. I have an employer that has a convenience store. 6 years ago, we started working together because they had extremely high turnover. They could not keep a full-time person working for them. So they decided to pay for benefits. There's 7 people that are full-time in this company. 2 years later, so this was 2006 when we started their group health plan. In 2008, they had 0 full-time people leave. And actually, we've only had 1 person turnovers from then till 2013 because they've decided to offer benefits. So it helped them accomplish that goal. Then 2 years ago, they identified another problem. They were having, of their full-time people, they didn't pay for sick days. They were having between 4 and 5 days missed on average, of all those employees every year for sick days. And they were finding that we were paying 100% for the health insurance, but nobody was using it. Nobody was even going to get a flu shot or a wellness screening, anything. So last year, we just had our second time renewing on this. They decided they're going to charge every employee $25 until they go do a wellness something or other during the year. Could be anything. But we're going to charge you $25 a month, a very small amount. Every single employee goes and does a wellness screening every single year now, for the last 2 years. And last year when they tracked it, the first year we implemented it, they actually took those average 4 or 5 days down to 1. They had, on average, employees miss 1 sick day. That was a pretty quick turnaround for that, and so we'll see if it continues. But there are some things you can do as a company still, regardless of healthcare reform, to help attract, motivate. And because if I had one goal for everyone that works with me, is that how do I help you out-profit the cost of a new regulation? How do we structure a benefit plan in a way that you make more money, retain more employees than whatever the cost of healthcare benefits are? So